I'm back with OSCE after a long time. First slide shows the X-ray picture. What is the diagnosis? From the X-ray we can only say it's a mediastinal widening. There is no definite criteria for saying that there is mediastinal widening, but I usually take it more than 1/3 transthoracic distance at the level of aortic knuckle as mediastinal widening. What are the causes for this mediastinal widening? The best way to remember it is as 4 or 5 T's. That is thymus, thyroid, retrosternal extension of thyroid, teratoma, that is the germ cell tumor, T cell lymphoma, which means most of the non-Hodgkin lymphoma are T cell lymphomas, T cell leukemia, the rare one. Superior mediastinum is above the sternal angle, which contains basically the vessels, the arch, the aorta, and the main vessels. So inferior mediastinum, the anterior mediastinum is what we have already described as various T's. Middle mediastinum basically contains the heart and a few lymph nodes, and the posterior mediastinum that contains various nerves and lymph nodes. And nerves, neurofibroma can come from the nerve and give a shadow, and from the sympathetic chain you can have neuroblastoma, and occasionally the paraspinal abscess shadow can simulate the mediastinal widening in X-ray appearance. The history comes only now. That is a 7-year-old male child, cough and breathlessness for 2 weeks, not improving with nebulization and cough suppressants. There is facial puffiness and acute worsening of dyspnea and noisy breathing today, and that's why the child is brought. And important things are the saturation is down, and heart rate is high, heart respiratory rate is high, there is stridor and wheezing. What other clinical finding you will look for? See, because of facial puffiness, in a case of mediastinal widening, SVC obstruction is likely. So we must look for distended veins and facial plethora. And acute worsening of dyspnea means the airway is compressed or invaded. So malignancy is very likely. So we have to look for lymphadenopathy and hepatosplenomegaly. The child is very restless and refuses to lie down. What should be done? See, actually the child is adopting a position in which airway is maximally patent. So the best thing to do is do not disturb the child. Let the child be in a position which he finds as comfortable. So do not force him to lie down supine, because in supine position airway may get further compromised. No sedatives for restlessness. The blood counts show all the counts are low, and interestingly the uric acid is high. So what is your comment on high uric acid? High uric acid is likely in malignancy. You can recollect in malignancy, before treatment we give drugs to enhance uric acid excretion. So if you keep it in mind, this will click. What are the two most important investigations now for this child? CT and blood smear. CT to localize the obstruction and know the character of the lesion, and blood smear basically because we are suspecting malignancy. And of course bone marrow and FNAC or the biopsy of lymph node is very important, but not an immediate priority. Will tracheostomy help? Unlikely, because from X-ray the mass is well below the cricothyroid membrane, where we usually do the tracheostomy. And even the endotracheal intubation will help only if it bypasses the obstruction. The level of obstruction, of course, the CT will tell us. What is the most important drug to save this child? Basically, this child is desaturating and we need something to decrease the obstruction. So dexamethasone will bring down the edema, and in addition, even if it is malignancy, that also will shrink with steroids. So that is the first drug to be given. Of course, if malignancy is already characterized, you can give the first dose of chemotherapy, which will again shrink, but that is unlikely in an acute setting. And the final clinical diagnosis, if the diagnosis is asked after all these things, then it is a mediastinal mass as shown in the X-ray, and SVC obstruction as shown in the clinical finding of puffy face, and airway compression as shown by the stridor and desaturation. Thank you.